Hey guys, it's Aristotle from my first year on T. Two things before I start this. One is that I'm officially switching my name from Aristotle to Nathan. It was something I had been debating for a while, but I had talked to my mom and she said that, if I had been born a boy, signed male at birth, that she would have named me Nathan. And so because of that, I have more of a connection to it, and so yeah. Anyways, it's going from hi, I'm Aristotle to hi, I'm Nathan from my first year on T. So yeah. Second thing is the other video I was gonna post last week, but my computer is totally messed up. I need to get it fixed again, and it's still not fixed, but I have another way of uploading now, luckily, because I can edit and then I could send it to my phone and then I can upload on my phone. I'm lucky on that part, but yeah. So because of that, I'm uploading this, but I'm going to be using footage that I filmed for last week. So just be warned, like, all the dates are kind of off. And so yeah, it's just a week later. Also a little update on what I didn't talk about a while. I think there's a part in it where I show my chest. So I was gonna tell you guys what I can feel and what I can't feel. I'm not gonna take off my shirt for this, but basically I can feel most of my chest except for just above my nipples, so I'd say that much above my nipple, so about an inch. And then I can't feel all the way back. You'll see my scars, how far they go back. I can't feel all the way back there. I can feel about an inch out from the thing, so just that general area, and a couple inches down, or I think like an inch also down from my scar. I can't feel, or I feel very weirdly. So yeah, that's all, and then here are the videos. I'm back. It's the second week away, or I was away, but I had, as you can see, top surgery. And I'm really happy about it. Like, my chest is super flat, and like when I look in the mirror, I just like, I have a shirt on. It's like a really baggy shirt, and I look like how I wanted to look like for so long, and it's so invigorating. But yeah, so I'm going to add in the clips right now of videos I've taken during the week. I think I took 2, and they're just kind of updates and just basically me talking about how I feel and stuff like that as I recovered. So yeah, and so there's here. Hey guys, so it's day 1 after the surgery. I had it yesterday. It's actually the 30th right now when I'm recording this. So yeah, I'm feeling great. I have a lot of mobility. Like, I could lift my arms up to like midpoint, like straight out, but I don't want to do it because it hurts. So this is what it looked like. I don't have any drains. Luckily, I didn't bleed as much as I thought I did. I had some breathing problems right after, like I was breathing really shallow, but other than that, I was fine. They said it went pretty well. And that I had no complications, so that's a good thing. I haven't gotten like a hematoma or anything. So what I got done was a mastectomy, double incision, with nipple grafts, and I got liposuction on the little, like, I had a little fat pockets right here. So I had liposuction to get those down a little bit. You can't really see them now because they're covered, but yeah. So yeah, I'm actually feeling really well. I have I don't know, 320 milligrams, I think, of hydrocortisone. I can't remember. I have an anti-inflammatory and anti-pain. I don't have nausea just because they gave me a shot and then they also put it through my IV for anti-nausea medicine. So, yeah, I'm feeling pretty good. And I just feel like I've gotten punched like 3-4 times in the chest. But otherwise, I'm doing well. So yeah, there's gonna probably be like several other updates and videos, and on Tuesday I might not post, but we'll see how I feel by then. So yeah, bye guys.
So today is day 2 post-op of top surgery with, oh, by the way, I never said that, Dr. Hopley. He's from Kaiser. He did great, I think. I heard really good things about him. As I was sitting there, they were trying to reassure me. They're like, oh, Dr. Hopley, yeah, he's great. I was like, oh, good, because I haven't seen anything yet, so. But as you can tell, I'm taking this from a different point of view. And my voice is crap. Mostly because yesterday was a lot. I had like 4 people over at the same time. My mom, my auntie, and 2 of my friends. So I was talking and I was moving around a lot. And I had great mobility yesterday, but now I just feel really, really weak today, where I can barely move my arms from my sides. Like, it hurts to move them, but I also can't put them directly down because that's where the liposuction was. The liposuction actually hurts worse than the incisions. The incisions are fine. It's just the liposuction. So yeah. There are people outside my door. Yeah. So, took a shower on the first day, back and shaved. But, other than that, they stuck a thing down my throat so that I'm like breathing oxygen during surgery, obviously. And when they did that, my throat was really hurting. So I'm not going to be talking much today, I don't think. But otherwise, I feel pretty good. I just took my pain meds, so it's kicking in probably. And I just have very low mobility, surprisingly. If you watch Calvin, I can't. He's another trans guy who just got surgery, and you could look at his video. He had a lot of mobility. I feel like it's the same thing. He had a lot of mobility, and then he kind of moved too much, and then he got very low mobility, where he can barely move his arms. So I think that's what's happening to me. So yeah, and I just wanted to update just because I was going through like the top surgery tag and like Tumblr and stuff like that. It kind of hit me that like I always knew I was like privileged to have this, but I remember when I was like a baby tran and I wasn't on T. I was pre-T and I was pre-top surgery. I was pre-everything, and I was like, oh my god, one day I'll get top surgery. One day I'll be 1 year on T. One day I'll be like I won't be like a tiny tran anymore. And it just occurred to me, like, I'm like pre-op, or not pre-op, I'm post-op, and I've been on T for almost 8 months, and it's crazy to think that I went from having nothing to having so much in my life, and just so much stuff has changed, and it makes me happy to know. So yeah, that's my chest. There's like pads underneath it, so it looks really swollen right now, but it's not. And yeah, I can touch it. I feel nothing. I feel more of like the sensation of me hitting it than I do underneath. It's very like, I can barely feel up to here. Like it's very numb. I can only feel my hand touching it. If I go down here, I can't feel anything. So yeah, that was just a little update. And if you are a baby tran and you're watching this, yeah, if you're a baby tran, just know that it's coming. It's coming, and you will feel great one day, and you will feel like yourself one day. Like, you'd be surprised. So yeah, I know that I had a very hard time before top surgery just because my chest was so big, but I also really hated binding because it made me hurt. Like, I was in a lot of pain every time I binded. I don't know why, I just didn't. I just was, and it was really hard to deal with. And so yeah, I think it's good. You'll get there one day. Just stay optimistic and know that you'll get there one day. So yeah. Bye. Hey guys, it's Aristotle. It's day 5 currently. Post-op, technically. Day 4, but day 5 really. No, day 5, yeah. So it's July 4th, obviously. And so I've basically just been chilling. There hasn't been much to do. They never tell you about how bored you get. That's always a big thing. I definitely feel like if you're planning for top surgery, plan something to do, and for friends to come and hang out and stuff like that, because otherwise you will be bored out of your mind. So I'm currently on like the itching stage, so that's common, and my chest really itches, like a lot, and I can't itch it, so yeah, it sucks. But that's where we're at right now. So yeah, see y'all in the next installment, or just next week. Hey guys, so it is officially 1 week post-op with Dr. Hopley in San Rafael. So I'm feeling pretty good. I take pain meds obviously, but like I take them every 12 hours, and it's just Tylenol. That's how it looks like. I have stains and stuff. I'd just like to say that, like I said, be prepared to be bored, and be prepared to already want that post-op date to be coming. Like, you will honestly just be like, please, post-op. Because that's me currently. I am basically just sitting in my room. I mean, I've gone out, but not that much. Just like once a day. I have a feeling my scars are going to be pretty stretched because I keep on moving around, even though I'm not supposed to, and I'm not supposed to raise my arms, but I have pretty great mobility. Like, I can stick my arm straight out, and it, like, doesn't really stretch that much. My arm can go to right about here before I start feeling stretched. So, like, yeah. Another tip, wear gauze pads. If you get one like me, you're gonna get, like, it irritates my skin for some reason or another. And so I have gauze pads right here. That's also a good idea to have, just in case. You also get this. So yeah, that's, I've officially, like, kind of got past the itchy stage, so I'm still itchy every once in a while, but it's not all the time, but it's still annoying, and yeah, it sucks when it does happen, because you can't itch. You're just like, just have to wait for the itch to go away, because your skin's repairing itself, basically. So, yeah. Other than that, I don't have, oh, also, you're gonna stink. It sucks. It really does suck. Even when you try to take a shower, like, I try to take a shower by, like, bathing and scrubbing and, like, getting a thing, and I can technically take a shower, but it's still, like, you still smell. I don't know why. It's probably because you have just a large portion of your body being, you know, covered constantly, but and you can't wash it,
and it's cloth that you sleep with and sweat in, and since it's summer for me, I'm definitely sweating. That it's probably like, you know, worse. So yeah, that it sucks. Definitely have somebody do laundry for you, because sometimes you just rinse off as best as you can, put on deodorant if you can. I can, because I can raise my arms up enough, and just cover yourself in clean clothes. So yeah, it's currently Friday right now, if I didn't make that clear enough, and I'm getting them off on Monday, so I will do a reveal in Tuesday's video, probably, maybe, I don't know. It depends on what the doctor says. If I have to keep bandages on, if I have to do something, then I'm going to postpone that, but for now, I plan to do it on Tuesday. So yeah, I'm feeling pretty good. Having a hot flash. Other than having a hot flash, I'm feeling pretty good. So yeah. See you in the next installment, if I make one. Bye. And we're back. And I'm also gonna, after this is just a kind of an update, because I had my post-op appointment yesterday, and after I discuss basically the whole process that I went through, how overall I think of the results and all that stuff, I'm going to show you my chest. So just a warning, I'll put another warning and say another warning before, because it's still a little gruesome, but it's actually, they're really, really good. My scars are really, really good, and I'm really happy with the results. So just a little recap, I had top surgery with, I had double incision mastectomy with Dr. Hop Lee, or Lay, I don't know, people pronounce his name differently, in San Rafael through Kaiser. And yeah, it went well. I was super happy. I remember freaking the fuck out. I was freaking the fuck out the entire ride there, because it takes like about an hour and a half to get there from where I was. So from where I'm living, so like the entire time I was just freaking out, and I'm like, oh my god, I've never gone to surgery before, I don't know how it's gonna be, what if they ask me something and I don't know, because I hate being ill-informed, what if, like, just what if, you know, and like, I feel like that is a very big thing that a lot of trans guys do right before top surgery. And of course, because you're like having surgery, and I've never had a surgery before, so I didn't know how I'd react to like anesthesia and things like that, so it's nerve-wracking, obviously. And so yeah, I got there and everyone was super nice, super kind. It was really early in the morning. I actually had gone from like 6, it was supposed to be at like 6:30 a.m., but instead they changed the time, so I got there at 9:30, except we got there at 8:20 because I wanted to be there on time, and we didn't know with traffic, because it was in the morning, how long it would take, because we'd be having to go through San Francisco. And so it could take anywhere from 1 hour to 2 hours, depending on traffic, you know, because San Francisco traffic, it's fun. And so, yeah, that's what happened. Sorry, my hands keep on going here. It just feels great not to have something in my hands. It's just, like, I can't get over it. Like, I've caught myself just looking down at my chest and being like, damn, ooh, so good. Anyways, back to the topic. We arrived there, everybody was super nice, super fun, super, like, just overall welcoming and understanding. I went into the pre-op, they made me change, you got out of your clothes and all that stuff, all that jazz. And then I went in, and then they did like all the stuff, checking me up, and I waited there for a very long time, worrying, and I was talking to the nurses, and they were all super nice, and they all had, you know, met Dr. Lay, I'm gonna call him Dr. Lay. But all of them had met Dr. Lay and had seen his surgery performance, and so they knew he was a good doctor, and they were just giving him like saying like, oh yeah, you're in great hands. And they went over the surgery with me and what was going to happen, and yeah, so that happened. And then Dr. Lay came in and drew on my chest and, you know, did the little blue marker thing that's not going to come off for a while apparently, and said, this is where the incisions are, this is how it's going to go, yada yada yada, we're going to understand. He also told me he made something, I'll tell you about it later when you see my scars, of how I feel about them, because there were some things that I didn't like, but I like now. Like, I didn't think I would like them having to go into the surgery, but I have them now, and I am absolutely like happy with them. I love them. I think they're doing great. So yeah, after that, I just basically waited, and then I went into surgery, and then they told me what they were doing, and then they did like their little introduction thing that they're supposed to be doing, and then I passed out. And they always tell you in the as you're going through top surgery, and like when you're actually talking about surgery, they're like, yeah, you're literally just you're gonna go to sleep, and you're gonna wake up, and your chest is gonna be gone, and you're gonna be in pain and maybe nauseous, and that's it. And it's like, and I really did not, like, I feel like I had like thoughts in my head of like, maybe I'm just gonna, you know, like go to sleep, but I'll feel like I'll be like asleep for a very long time. No, you really, like, you pass out, you count down. They didn't ask me to count down because I was already mentally counting down, so you count down, and like, boom, you're out, you're gone. You just don't, like, you feel funny for like 3 seconds, and then gone. I was gone. And for a second, I actually heard them for like another full minute talking about what they were gonna do, and like getting stuff like set up, and like, you know, understanding things. And I was like, holy shit, no, I'm not having anesthesia awareness. But I went back to sleep, and I was fine. But like, it was freaky for a full minute. I was freaking out. And then I went back to sleep, and I was fine. I shoved that thing down my throat. I didn't know that. I know that only when waking up, because I felt it in my throat. It sucked. My throat hurt for like a couple days afterwards. I might have talked about that in the videos. I don't remember. So yeah. And then I woke up. I was in pain. I was really nauseous. I was nauseous, but like, I was fine after a couple minutes. Like, I was like, I remember waking up and like thinking there's a million times telling her, I was like, you don't know how great this is for me. You don't know how wonderful I feel. Like, you don't understand. Like, thank you so much. Thank you for caring for me. And she was like laughing. My eyes were closed. I was like, you know when you're like, this, okay. Yeah, it's just, I was gone. And then I kind of like the anesthesia wore off, and I was kind of fine, and I was nauseous, and then they gave me a pill, and they also stabbed me with a needle. They're like, okay, here's your shot, go, like anti-nausea stuff. I was like, cool, thanks. And then I was fine after that. Ate some crackers, then I got in the car, and we left, and I got Jamba Juice, and then I don't remember much after that. The next couple of days were kind of like a blur, but like, I remember the second day coming out of surgery, I felt great. Like, everybody was talking about all these things that happen, and like how you might feel bad, or how you can't raise your arms up, or stuff like that. Like, you can't do that for like a couple weeks. You have to you're basically like this for a couple days, like with your arm. I'm doing basically like my arm cuffed to my side. But yeah, they talk about that, and I was like, I am not experiencing any of this. I could raise my arms up within the second day up to my shoulder height. This is currently where it starts to stretch. This is what, like, I was like slumped like this for like a good week, just because it pulled the stitches, and I didn't know if that was bad or not. And so I haven't been standing up straight for basically 2 weeks. Until the lady was like, oh yeah, you're fine. You could, like, the person who did my post-op care, who was a nurse. I didn't see the actual surgeon, but the lady who worked with him very closely. Yeah, it was like, oh yeah, just it's normal. I was like, oh, okay, cool. And so yeah, I was able to move. I was able to do a bunch of stuff. Like, I was in pain, but I wasn't in that much pain. I was really fine. And then right now I'm barely on Tylenol. I take like 1 pill a day. Just, because I get a little achy if I do it too much, but if I'm like normal, I'm fine. So yeah, that's everything I went through. The surgery went great. Apparently it went wonderful, like absolutely great. I do very much recommend Dr. Hopley. Like, if you go through Kaiser, you can go through anyone, go through Dr. Hopley. Like, they were just telling me all this stuff, and I was super surprised with the results, because as I said, and I'll show you in the scars, sometimes most top surgery scars don't touch. They usually don't. But my chest, it was so big, and the way my breasts formed, it went like that, and then they had like this little fat, like overhang, almost. So it didn't go straight down the middle. It didn't go like chest, like rib cage, stomach. It went like chest, and then there was a bump as the skin had like a flap, and then it went into my stomach, So yeah, as it went into my stomach, so because of that, my surgery scars do connect. They do connect in the middle. And that's one thing I just really didn't want. Like, I did not want that, but it otherwise would have looked really weird. So I was like, oh, okay, like, that's something I very much can accept. Like, it's okay to me if I have them connect. And he did it exactly the way I wanted to, where the scars are like not curved, but they are curved, but they're not like that. Like, some people like them like that. I don't like them like that. I wanted like this, and they do that. They do this like tent formation where there's a little curve, but it's not like super dramatic, but it's also not completely straight, which is exactly what I wanted. And I was talking to the lady, the nurse who treated me afterward in my post-op, said that like he's really delicate when it comes to this stuff. They also did liposuction on my side. Just because I had extra fat back here, so my scars go back pretty far, you'll see. They did liposuction, and there's like raised skin where you can see it. It's really far back. But yeah, overall, I am extremely happy with how it went. And every time I look down at my chest, I literally cannot get enough. Like, I freak the fuck out every time I look down. There's not anything there. I'm like, yes, this is exactly what I wanted. Yes. Now I'm just waiting to heal so I can start working out. So I can be like my top self. But yeah, I like, a lot of people like talked about like, oh, and I think it's also because surgeries have advanced, because the people I was talking to were more about like 3-5 years back, where they got their top surgery, but the surgery itself has advanced, so there's not as much pain, there's not as much body trauma. Like, it just, your body can regenerate well. And it's also on part that I heal really, really well. When I get scars and cuts and things, like, if it weren't for like the kind of regenerative power, I don't know why, my skin has, I would have tons of scars all over my arms just from like, playing around and being a kid, just because I would like get cuts and bruises everywhere, but you literally cannot see. One time sorry, I got close for a minute. One time I was playing around and I totally smashed my face into the floor and cut from up here all the way up here, just skin totally scraped off, and there's not even a scar. So like, I have really good skin, and I'm very, very lucky for that. And so yeah, my skin also does really well, but he was also a really good surgeon. So because of that, I'm extremely happy in how everything is going. Like, a lot of people are very like, they don't like feel like they're like weird after surgery. Like, they're like, my chest is like, it's like they feel really great about it, but it's like there's no euphoria, it's usually just relief. But I have euphoria and relief. Like, there's relief as I finally get to present the way, like, I feel. But there's also euphoria because every time I look at my chest, I'm like, oh my god, like, this is a thing, and I'm so happy. I just get so overjoyed by it. Which I'm glad that I didn't go into a depressive state, which a lot of people do. So, yeah. After that, now I'm going to take a shower, and when I take a shower, after I take a shower, I'll come back and I will show you my scar results, describing stuff, and just commentary, and, you know, just showing you how it's gone. So, yeah, I'll see you in about, well, for me, it's going to be about 45 minutes. For you, it's going to be a couple seconds. But yeah, if you don't like gore, you don't like kind of that stuff, there's not really that much, there's not blood, like, there's no blood, it's like dried blood. But if you don't like stitches, you don't like skin, like, just, like, looking like it just, you know, got surgery on, then just be prepared. You don't like wounds, just be prepared. If you don't like seeing chests or nipples, be prepared, okay? Okay, see ya. Okay, hey guys, I'm back from my shower. My hair is a curly mess. But yeah, just saying, again, if you have a problem with scars and weird things and bumps and stuff like that, don't watch this video. So yeah, I'm actually gonna drop this, and so you'll basically be staring at my chest the entire time. And it's gonna be dropped a lot. I have like a little setup. I'm a squat, probably. Okay. That is my chest. 1 week post-op. I cannot speak. But yeah. So, as I said before, my chest is connected in the middle. I did not like that. Sorry, better lighting. My chest is connected in the middle. I did not like that at first, but, you know, you gotta get what you gotta get. And I'm okay with this. And it actually does not look bad. I'm very happy with my results. So yeah, as I said, my scars go back pretty far, mostly because I had a lot of fat. So these are gonna definitely like recede, but until then they are left as they are. And also everything is held up by glue. The surface of my skin is held up by glue at first, and it's basically just staying on and waiting and until the glue kind of comes off on its own. It's peeling in certain spots, like right there. Oh, also you have to put Vaseline on your nipples, at least they asked me to, so I have Vaseline on my nipples. But yeah, so that is my chest 1 week post-op. I am very happy with the result. My skin definitely could have done a lot worse. Apparently I have some of the best nipples she's seen, so I'm very proud of that. I'm gonna be like, it's gonna be a joke that I keep forever. It's gonna be like, I have the best nipples. And I have definitely been like going crazy over it. So yeah, that's all I had to say for that. That's my video. What else was I gonna say? I was gonna say something. So yeah, aftercare, so far I do not have to do scar care, mostly because my glue hasn't come off, and also under the skin. So if you have these are my wounds at the top, and you see how there's like a kind of, on my chest there's like little dimplings right there, and like right here and stuff. Those are gonna go away in time, don't worry. So my skin's like this basically at the moment. There is sugar dissolvable sutures under the skin. They're basically like where my wrists are, and once those dissolve around 2 weeks in, so my next post-op appointment, which was on Thursday, it is going to flatten out so that everything is nice and flat. But for the moment, it's kind of puckered. So also everything is kind of like it's stretched. It takes a while for you to be able to stretch back. So it's pretty normal to feel stretched. So I don't have any scar care. The only things I have to do is to, when I take a shower, put Vaseline on my nipples, like I said, and then I have to cover them. Sorry, that's my dirty closet. And then I have to air dry a little bit, and then I'm covering them with bandages, just cloth bandages, or not cloth bandages, but like regular big bandages. Sticking them on there, and then wrapping myself with either old binder, tight sports bra. I use Ace bandages because she gave me permission, and I personally feel more comfortable with Ace bandages because they make more sense to me. But yeah, and then I just wrap myself, and then I'm done, and then I have to keep it on basically the whole entire time unless I'm air drying and I have Vaseline just on them. So yeah, that's all. I will update you guys next week. Next week I will be doing this week's video and next week's video in one, so that's gonna be a little bit of a longer video like this was. So have a good day. I will see y'all later.